Well, today the FDA announced it has authorized the use of Pfizer's single booster dose for children ages 5 through 11. It comes nearly a year after a New Orleans family enrolled their 3 young children in the Pfizer vaccine trial. ABC News has been following this family since last summer when the parents, who are both doctors, by the way, took part in the trial. 6-year-old Ellie got her first COVID shot in June. 4-year-old Christian got his several weeks later. And their youngest, Sloan, who's now 22 months old, was also vaccinated. Their parents, Erin Biro and CJ Bowie, they are doctors at Ochsner Health there in New Orleans, and they join us now. What a great city. I'm very jealous about where you live. I used to live and work there, and I know Ochsner very well. Guys, so glad to have you with us. Erin, let's talk about why it was so important to you both to get all 3 of your young kids vaccinated, why you believed in it, why you did it, why you didn't hesitate.
Sure. So for us to get vaccinated when the vaccine first came out was a complete no-brainer. We were in the thick of things. We were treating COVID patients. We wanted to protect ourselves. But that's the exact same reason that we felt strongly about getting our kids vaccinated as well. We didn't know if we would get exposed and then bring COVID home to them. So any extra layer of protection that we could offer for them was of utmost importance. We were super excited to have the opportunity to participate in the trial because it meant that we had the opportunity to potentially vaccinate our kids earlier. And from a safety perspective, we just truly wanted to keep them protected from a very dangerous disease at that time.
Sure. And CJ, Ellie's first shot, I understand, was actually a placebo. She later got the Pfizer vaccine. Did she have any reaction to the actual shot?
No, not at all. I mean, we spoke her through it. I think, she tolerated the shot a lot better than I did, actually, from a symptom perspective, because but overall, actually, none of our kids had any significant side effects or any negative impact from it. They all took it like champs.
And as doctors, and let me ask you this, CJ, are you concerned about any long-term effects? I mean, you've been right in there treating patients. You're in the health community, because there are still parents that are nervous about all this and what could possibly happen 6 months, a year, even more down the road, because we really don't know ultimately the outcome of all of these shots and vaccines.
Yeah, that's a great question, Kara. I mean, first and foremost, we are parents, before we are physicians. So obviously we understand the concerns about, unknown long-term kind of side effects. But I think what's become clear now is, worldwide, we've given, 6 or 7 billion dosage now. And I think that the medical community across the world has, uniformly agreed that the vaccine is safe for both adults and kids. And, me as a pediatric neurosurgeon, I'm actually acutely aware that some of the longer impact of COVID itself, particularly, around long COVID brain fogs that we're finding in adults, a lot of studies have shown now that it does impact the brain. It causes inflammation around the spinal fluid. And so I would kind of turn that question around to a lot of parents worried about unknown kind of side effects from the vaccine to say, I think that the unknown side effect on neurocognitive impact on kids is a significantly higher risk, because we do know that even though it's less common, long COVIDs do exist in kids, and we yet don't know what the long-term impact on, on kids' brains and on the development will be. And I would argue that's probably a significantly higher risk than anything that we would see from any of the vaccines.
Erin, do you plan on getting your oldest boosted now that the FDA has authorized that additional Pfizer dose?
Yeah, so the kids are all actually still in trial, so they're still following data points for all 3 of them. And Ellie is actually getting vaccinated in trial in 2 weeks from now. He had to wait just because of trial protocols, but I had planned that months ago, even before the FDA approved that third dose. She was absolutely getting her booster shot.
Of course you planned. And Erin, a new Kaiser Family Foundation poll actually finds if vaccination is approved for kids under 5, only 18% of parents are willing to do it. So what would you say to those hesitant parents?
You know, I echo what CJ just said, that the safety profile is, for kids specifically, is a year out now. We have a year's worth of data, and the data profile is safe. Kids are tolerating this very well. And I kind of look at the COVID vaccine like any other childhood vaccines, that it's a safe and effective way of keeping our kids safe. And furthermore, I think one of the biggest pluses for us is that since all of our kids are vaccinated, if there's any exposure at school, our kids actually don't have to quarantine, that they can all stay in school. And I think the effects of missing school, missing time away from their friends is also significant on kids. So the more we can keep them in school, the more we can keep them with their peers is just really important.
Dr. Biro and Dr. Bowie, thank you so much for your time. Love your insight. We'll continue to follow the family. Hope you don't mind.
Absolutely.
Not at all. Thank you for having us.
You bet.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.